I'm not a lawyer, but now that I've covered the prosecution side of the Lindsay Clancy trial, now let's talk about the defense, and more specifically, how her attorney, Kevin Reddington, seems to be building the argument that Lindsay Clancy's medical doctors failed her. Thus far, the theory seems to be that Lindsay Clancy had bipolar disorder. But instead of her doctors recognizing her signs and symptoms as bipolar disorder, they diagnosed her with anxiety and depression. And the problem with those diagnoses is that one of the most common ways to treat anxiety and depression is to prescribe a class of drugs called SSRIs. But what's apparently known in the psychiatric field is that prescribing SSRIs to a person who has bipolar disorder can make their symptoms worse. And so the theory is, if Lindsay Clancy had bipolar disorder, but her doctors didn't diagnose her as that, they were prescribing her medication that, instead of making her better, made her worse.
One of the things that you don't do, which is taboo, is if you have somebody that's bipolar, you don't put them on an antidepressant, you don't put them on Zoloft, you don't put them on what's called an SSRI, selective serotonin reuptake inhibitors. It messes with your brain. You don't do that, but it was done in this case.
And so thus far, Reddington's cross-examinations have been primarily focused on the medical care, or lack of care, that Lindsay received. And this kind of tailored approach of only focusing on Lindsay's medical care has actually made the trial go by faster, because it means Reddington isn't cross-examining every witness. For example, he didn't cross-examine most of the first responders, he didn't cross any of the medical staff that worked on the kids, nor did he cross the DNA expert who testified about whose DNA was on which band. In fact, he and Lindsay Clancy stipulated or agreed that the prosecutor didn't even need to prove certain facts related to the DNA or the chain of custody for the DNA because they aren't contesting that. Here is a clip of one of the only times you'll hear Lindsay speaking, where she tells the judge that she agrees to these stipulations.
Do you understand that the Commonwealth, in this case, is required to prove each and every element of the case against you beyond a reasonable doubt? Do you understand that?
Yes, Your Honor.
All right. And you understand that by signing the stipulation, you're agreeing that the Commonwealth does not have to prove these certain facts that are contained in the stipulation. Do you understand that?
Yes, Your Honor.
All right. And do you understand by signing or going along with that stipulation, you are basically relieving the Commonwealth of its burden to prove those certain facts? Do you understand that?
Yes, Your Honor.
All right. Is that what you want to do at this point?
Yes.
All right. Have you gone over this stipulation or the summary of the stipulations with Attorney Reddington?
Yes, I have.
All right. Need any more time to do that?
No, thank you.
All right.
I just would like, Your Honor, for the record, to again reiterate the fact that we have not been contesting the government's case in chief, if you will, have been agreeing to evidence, and this stipulation basically relieves the government of having to bring in dozens, if not more, witnesses to prove chain of custody of blood, fluids, the bands, DNA, all of that. Rather than have days of testimony, this stipulation will avoid that. So that's why we're stipulating to it.
All right.
Okay, so now let's get into what Lindsay and Kevin Reddington are contesting, starting with Lindsay's primary psychiatrist, Jennifer Tuft, who Reddington says advertised herself online as a postpartum specialist, even though she had only been out of residency for about a month and a half when Lindsay first became her patient.
Forgive me, how many women did you treat for postpartum depression in that month and a half before you met Lindsay?
I don't know, maybe a couple. But I've treated many of them in the residency, which was just immediately before.
So when someone comes to see a psychiatrist like you, it's because they need help, right?
Yes.
And when they come to you because they need help, for example, with Lindsay Clancy, she came to you because of your ad, right? Or your website for Asked It, what you said about yourself.
I don't know exactly how she found us.
So you understand that if, in fact, it's determined that you advertise as an expert in postpartum and in postpartum psychiatry, and you've had a month experience plus a residency, would you consider that to be negligent or misrepresentation?
I do not believe that I have been negligent.
Do you understand what misrepresentation means?
Yes.
With a month under your belt plus your residency, do you really want this jury to believe that you were an expert? Can you advertise that?
I don't think that's exactly the wording that I used. I think I said that it was an interest of mine.
Well, that's
the answer. No. Good answer.
I just think the wording was that it's an interest of mine. I don't believe I called myself an expert.
Are you an expert in postpartum?
I may be. I don't know. I think it depends on what you define an expert as.
Next, Reddington highlights that of all the appointments Dr. Tuft had with Lindsay, and again, there were 14 in total, she had actually never seen Lindsay. Just watch.
Did you give a handshake when you came in your office?
It was telemedicine.
It was what?
Telemedicine.
Telemedicine. Is it fair to say there are 14 appointments that you had with Lindsay during that period? Every single one of them were by telemedicine, weren't they?
Yes.
Until you came in this courtroom Friday, you never saw this woman in person, did you?
Correct.
She told you symptoms that she couldn't get out of bed. Isn't that right?
At one time, she said it was difficult to get out of bed.
Oh, difficult to get out. Why was it difficult for Lindsay Clancy to get out of bed?
Because she was very depressed.
And did you give her a hug? Oh, no, you're on telemedicine, so you couldn't give her a hug, could you? You didn't have any chance to even look at her in person, did you?
I could look at her. It was always a video appointment. I couldn't give her a hug, but that's not actually something that psychiatrists typically do with patients.
She's being funny, but low-key, she has a point. Next, Reddington digs into the claim that Lindsay never said she was suicidal and what work Dr. Tuft did to investigate if she really was or not.
It was a while before she mentioned anything about suicidal thoughts.
Tell us when.
I might need to look through the records to see when she first did. December 1st.
So on December 1st, what did she tell you?
That she denied feeling suicidal, but that she was close to feeling suicidal.
And how frequently were the thoughts?
I'm not sure exactly how frequent they were.
Did you ask her?
It's very likely that I did ask her the frequency.
Wouldn't that be in your medical records?
I don't have it documented how frequently they were, but that is a question that I usually ask when we're talking about suicidal
So when
thoughts.
you're usually testifying in a murder case, we usually have facts that we can tell the jury, not speculation.
Objection.
Sustained.
But it's what I said before, that that she denied having them, and she wasn't having them. We were meeting, but she felt close to it, close to having those thoughts. So I provided emotional support and validation and
What does that mean? Validation?
encouragement.
What does that mean?
Something like, I understand this is a very difficult time. It really, it varies on the individual.
Sure. How about Lindsay?
I don't remember the exact therapeutic words that I used.
Did she call suicide hotlines?
I was not aware that she did.
Did you ever ask her?
I don't think I specifically asked that
Not
question.
specifically. Did you ask her anything? Did you beat around the bush maybe? Did you ask her anything about suicide hotlines?
I don't think I asked her about suicide hotlines.
Would it surprise you to know that she called suicide hotline in that time frame, not once, but twice, and was turned away?
It does surprise me, yes.
It does what?
It surprises me that she called them twice.
Okay, now if you watched my previous video, you know that while Dr. Tuft was Lindsay's primary psychiatrist during this time period, Lindsay had also taken 2 trips to the ER. She had 1 trip to a mental health facility, and at one point she began seeing a completely different psychiatrist, meaning she had other records from these places that Dr. Tuft could have asked for, but Reddington highlights she never did.
When you looked at the records from South Shore Perinatal Clinic, what did they indicate about suicidal ideation, worrying about suicide, close to suicide, anything?
I didn't have access to those records.
You're going to keep your voice up so everybody can hear you. You what?
I did not have access to those records
None.
because we're a completely separate clinic.
Seriously? She's visiting with you as a patient and you can't access her medical records? Is what you're telling this jury?
I did not have access to them, no.
Could she have signed a release, a HIPAA form?
Yes, she could have.
And you could have got the records.
Yes.
But you didn't.
I did not feel like it was necessary because she provided all the relevant information about her treatment there.
How do you know? She's got a mental disease and she's seeing you and she's on all this cocktail of drugs. How do you know that she is an accurate historian at this point in her life?
It felt very accurate when she was able to recall the names of the medicines, doses of the medicines, specific days. She provided a lot of incredibly detailed information. So it showed me she was capable of doing that.
What about the records?
No, but that's typically not
No,
done.
never mind typically. The answer is no. You never got the records, right?
a discharge summary is a record.
Did you talk to the doctor that discharged her?
No, no one called me.
No what?
No one called me. I wasn't notified about the hospitalization until she was discharged.
So you just sit there behind your computer and wait for people, Patrick, wait for the doctor from McLean, wait for the sick person who's the patient to call you, and if these people don't call you, it doesn't exist apparently, right?
No, not exactly. I had no way of knowing she was even at McLean.
And then Reddington questions Dr. Tuft about the possibility of Lindsay having bipolar disorder and what her assessment of that was, especially considering Dr. Tuft prescribed Lindsay Zoloft, an SSRI, which has the potential of pushing someone who has bipolar disorder into a manic episode instead of making them better.
You also discussed with her the possibility of undiagnosed bipolar disorder, did you not?
It was discussed.
And undiagnosed bipolar disorder was, in your opinion, as a result of not a reaction, but extreme reaction to the SSRIs, right?
Not as a result of the SSRIs, but that
Does your note say, and I quote, also discussed possibility of undiagnosed bipolar disorder given extreme reaction to SSRIs and insomnia, period. Does it say that?
Yes.
Those are your notes, right?
Yes, the way you were saying it made it sound a little bit different before, but that's exactly what I wrote.
I read it directly from your note, right? How did that make it sound different?
I don't know. It sounded different the first time you said it than the second.
So did she have bipolar?
No.
Did you make that decision that night? That day?
I assessed that with her pretty much every time that I saw her, and she never had mania.
So Dr. Tuft says that Lindsay never exhibited signs of mania, but that comment leads to a bit of a mic drop moment when Kevin Reddington has Tuft read her notes from one of Lindsay's early appointments, where she seemingly says Lindsay exhibited a hallmark sign of mania.
The things that the district attorney asked you about on a number of occasions that seems to be important is if the person that you're treating has, I guess, what do they call it, pressured speech?
Yes.
And you told us repeatedly that you never detected that Lindsay had pressured speech, right?
Correct.
I'm sorry?
Correct.
October 21st of 22, is that correct, right up there?
Yes.
Okay.
Yes.
And can you just read this paragraph here for us?
No sleep last night. Falls asleep after 40 minutes. Heart racing, severe anxiety. Worrying about kids, baby, sleep. Yawns but not drowsy. Not hyper, pressured speech.
What was that? Not hyper what?
Not hyper, not pressured speech is what I meant. I know it doesn't say not, but that is exactly what I meant.
Wait, when did you see this that you noticed that it did not say not?
I don't care what it says. I know what I meant.
Well, when you wrote this, you did not say not pressured speech. You said in the medical record, pressured speech, right?
No.
Does it say that?
Yeah, the word is the word not is right before not hyper, comma, pressured speech.
Right,
The two
so
are following
what
the
does a comma
not.
mean to you? When you put down in a medical record, heart racing, comma, severe anxiety, comma, worried about kids, comma, baby, comma, sleep, comma, yawns but not drowsy, period. Not hyper, comma, pressured speech. That's what you wrote, right?
She did not have
Did you
pressured
write
speech.
that, doctor?
I wrote that, but you're misinterpreting my note.
Am I reading this correctly, and the jury will be able to look at it, that you put not hyper, comma, pressured speech? Did I read that right?
Yes, but your interpretation is incorrect.
As opposed to yours? That's all I have.
And then lastly, Kevin Reddington reads through the notes from Lindsay's last appointment with Tuft. And if you recall, the last appointment Lindsay had with Dr. Tuft was the day before she took the life of her kids.
January 23rd, and she said her mood was depressed, and you noted that her affect was depressed and flat, right?
Yes.
She also reported that her heart was racing.
Yes.
She had no motivation, is what she told you, right?
Yes.
She told you that she had been feeling numb and no emotion for 17 days straight, is what she told you, right?
I'm not sure about 17 days straight, but that's how she was feeling.
So she's sitting in front of her computer getting help from her doctor on January 23rd. And
what did you do?
Well, I thought about how I could best help her, the medicines that she'd tried and what her current symptoms were, and it made sense to slowly titrate the amitriptyline so that we could get her to a dose that reduced her depression so that she would feel better.
But you increased the amitriptyline.
Yes,
And that pushed you over the edge, didn't it?
I don't think so.